Imagine this, you're scrolling through social media and then there they are again. That wellness influencer with perfect lighting, flawless skin, and an inviolable morning routine. They're sipping their bright green celery juice followed by a collagen protein shake they can't live without. And then they're telling you how they heal their gut with a special probiotic that costs $80 a bottle. They look amazing, their skin is glowing, and they promise that if you just follow their plan, buy their supplement bundle, sign up for their app, and try their special diet, you too can feel this good. But that plan, it costs hundreds of dollars a month. As you look at your budget and your tight schedule, you wonder if something's wrong with you because you can't seem to make these simple changes work. One of the most confusing things people experience regarding their health today is figuring out what advice actually matters and who they should trust. Many of us will experience this confusion at some point in our lives or will know someone who has. If you are new here and you've landed on this episode, welcome. I'm Dr. Bio, your health advocate. I'm a practicing family medicine physician in Northern Nevada, and I bring what I see in my clinic into the work I do on the news, on social media, when I travel around the country speaking, and to this podcast. I was recently inspired by a creator on social media, Dr. Jessica Kernick. Shout out to Dr. Jess, who made a great video about the growing confusion between personal wellness and public health. Her insights really got me thinking about how this confusion impacts my patients every day. If you aren't familiar with Dr. Jess, she's a nutrition educator, registered dietitian, and holds a PhD in physical activity, nutrition, and wellness, and offers a great perspective, which is why today's episode is so important. I'm diving into the critical differences between personal wellness and public health because understanding this distinction might just change the way you think about public health forever. Here's something I've been thinking about lately. Despite all the wellness content we see on social media and all the health products being marketed to us, our healthcare system often isn't addressing the real needs of most Americans. We have all these wellness influencers selling solutions, but if you can't afford basic healthcare or don't have access to healthy food in your neighborhood, none of that matters to you as a patient. This reminds me of a patient, I will call her Lisa, who I saw in my clinic in a state of despair. She shared with me that she had started a supplement a couple of months ago. This supplement promised better energy, a better immune system, and the best benefit of all in her mind was the opportunity to lose weight. She started the supplement shortly after seeing an ad on social media. She followed it to a T. She had to take a couple of pills in the morning, evening, and there was this added protein shake that she had to make. Well, a week goes by, 2 weeks goes by, and she doesn't notice any difference in her mood. She doesn't notice any change in her overall energy, and she hasn't lost weight. The one thing she did notice was she was having some discoloration in her skin, and she wasn't sure where this was coming from. Well, she reached out to the company and they shared this is normal. This is something that is a part of the product and just to continue to take the medicine. So she continues on and then she notices her skin is becoming even more yellow. She decided to make an appointment and I saw her in the urgent care. She shared with me that she was feeling tired. She had noticed some changes in her skin. And as we're talking, I asked a couple more questions. Are there any new foods in your diet? Any new medicines? Anything different? And she said, well, yeah, I actually started a supplement, but it's not working. So I asked her to tell me a little bit more about the supplement. After reviewing the supplement, I was able to identify that there were stories of patients who unfortunately had suffered liver injury from this supplement. I shared this news with Lisa, and what was really telling was the fact that this discoloration or the yellow color that she was noticing in her skin was secondary or due to a condition that we call jaundice. Jaundice can happen when your liver is sustaining injury, meaning it's not able to do what it normally does. The product she was taking, we were able to identify it was actually causing injury to her liver. And that's where this discoloration, the yellow that was present in her on her skin, as well as the white area of her eye called the sclera, was also yellow. I share this story because it's important for everyone listening to know that just because a product is identified as natural or safe doesn't mean that it actually is that. Manufacturers can slap whatever label they want on a product or share that this product will change your life, will boost your immune system, give you more energy, help you lose weight. But that isn't always the case. And there's no regulation behind it to justify their claims. And unfortunately, with Lisa, this situation actually caused a very serious complication. And this real patient experience illustrates how personal wellness advice can fail a patient, not only from their own personal health, but also financially. Lisa had shared with me that what she was purchasing was $29.99 per month. She'd been on it for 4 months. So you can imagine how much money she had invested into this product. And Lisa is on a very tight budget. So she had really sacrificed her overall budget just to try this product because in her mind, she felt, I have more energy. If my immune system is boosted, it's going to help me work harder. It's going to help me maybe get a promotion, all of the things to bring in more income. Again, I share this story because it's so important to know that whatever you decide to put in your body, make sure you do your due diligence. Make sure you check and look, is this manufacturer been vetted and considered safe? What are the reviews? What have other people shared? Because in the end, whatever you put into your body, it has the potential to cause great harm, complications that may not be reversed. This kind of experience is why I've been thinking a lot about the recent news regarding our Surgeon General nominee. As of the time I'm recording this, Dr. Casey Means was nominated to be the Surgeon General. Now, there's a lot to unpack about why this nomination and why it raises some concerns. First, let's talk about Dr. Means' background. While she did complete medical school at Stanford, she never completed a residency program. This is really important to understand. So let me describe how medical training actually works. After college, future doctors attend 4 years of medical school where they learn the basics of medicine. But this is just the beginning. After medical school, doctors enter residency. This is where we get our true training in our specialty. Residency is where we work directly with patients under supervision, seeing countless patients and really learning how to be a doctor. That's approximately 12 years of schooling after graduating high school before they begin their careers. For example, I completed 4 years of residency in family medicine after medical school. During that time, I relocated to a new city because I matched there, which is a whole nother episode. But I treated thousands of patients from all walks of life with all kinds of health conditions in Chicago and Nevada. I delivered babies and held hands with older patients as they died. I quite literally cared for people of all ages and stages of life. That hands-on experience is irreplaceable. Board certification is another important step. After completing residency, many doctors take rigorous exams to become board certified in their specialty. Studying for these tests is no joke. People study several months before they even take this test. This certification shows that a doctor has met the standards of their specialty and has the knowledge and skills to practice independently. Because board certification is not required to be a doctor, this is one way to identify if someone is a credible source or not. You may also see people practicing outside of the area in which they did their residency. That also is a bit of a red flag. Dr. Means started her surgical residency to become an ear, nose, and throat doctor, but left before completing it. According to her website, she left to focus on how to keep people out of the operating room. She then moved into a specialty of medicine called functional medicine, which focuses on addressing the root issues of health problems like stress, sleep, nutrition, and so many other things. She also has cooking videos online and helps people learn how to use food as a tool to optimize metabolism and encourages people to eat a colorful diet. She co-founded a wellness company where she sells devices and monthly subscriptions for her app to elevate their health. Dr. Casey used to have a medical license in Oregon, but does not currently have an active medical license in any state and is unauthorized to practice medicine or prescribe medication. The Make America Healthy Again movement, known as MAHA, is very supportive of Dr. Means' nomination, but this brings up some important confusion that exists. As Dr. Jess first pointed out, there's a growing dangerous confusion about the difference between optimizing personal wellness and improving public health. They're not the same thing. Just because someone advises you to eat nutrient-dense whole foods, get outside, move your body, lower stress, get adequate sleep, and take supplements to optimize your health doesn't mean they understand how to improve population health. I want to share with you a powerful explanation from Dr. Jessica that really captures this distinction. Let me play a short clip from her recent video.
Public health isn't about optimizing individuals. It's about the systems and conditions that shape public health across entire communities, especially those that face the steepest barriers. That means addressing the root cause of disease: poverty, food insecurity, pollution, lack of access to care, racism, and disinvestment in the built environment, like lack of access to housing, poor infrastructure, and cities and towns that are not built with health in mind. None of those issues are solved with a high-priced wellness offering or individual choice. They're solved through policy.
Let me expand on this difference. Personal wellness is about individual choice, what foods to eat, exercise routines, supplements to take. These are good things, but they mainly benefit people who have the time, money, and resources to follow this advice. Public health, as Dr. Jess pointed out, is about systems and conditions that affect entire communities. Let me play another clip that explains this so well.
Wellness influencers often ignore these structural realities. They sell high-priced solutions to a very specific demographic of people, someone who has the income to purchase what they're selling and who often don't have to deal with those structural barriers. That's why you rarely hear discussion about housing policy or Medicaid or nutrition assistance in mainstream wellness spaces. And now, as some of these wellness influencers are in positions of public health power, we risk designing a public health system for the already healthy and leaving behind the people who need our help the most.
Here's something that might surprise you. According to the Global Wellness Institute, the wellness industry is actually worth about 6.3 trillion globally, while the pharmaceutical industry is worth about 1.6 trillion. That's right. The wellness industry is about 4 times bigger than big pharma. The supplement industry alone is worth about 485 billion compared to vaccines at 79 billion. So when we hear people complain about big pharma, we should remember there's a much bigger problem. Big wellness industry that is unregulated and marketing products to supposedly make us feel younger and look sexier. Now, don't get me wrong, pharmaceutical companies aren't perfect, but it's important to understand where the money is actually flowing and who has the marketing power to shape our ideas about health. The role of the Surgeon General is to be America's doctor, focused on public health for all Americans. The Surgeon General leads the U.S. Public Health Service Corps and issues advisories about public health threats, like the warning labels on cigarettes. When public health is done right, the results are incredible. According to the CDC, some of the greatest public health achievements in recent American history include vaccines that prevent millions of cases of disease and save tens of thousands of lives each year. motor vehicle safety improvements that have drastically reduced crash related deaths, tobacco control policies that have cut smoking rates significantly, safer workplaces that have reduced occupational injuries, childhood lead poisoning prevention through better housing policies and regulation. These achievements didn't happen because individuals made better personal choices. They happened because of policy changes, regulation, infrastructure improvements, and system wide approaches that benefited everyone, including those with the fewest resources. Let me share one more clip from Dr. Jess that really drives this point home.
For example, the current nominee for Surgeon General owns a wellness company called Levels, where they sell continuous glucose monitors to people without diabetes, and you can get a continuous glucose monitor and an app that tracks your macros for $224 per month. Her brother, who orchestrated the MAHA movement, owns a company called TrueMed, which allows people to use HSA and FSA dollars to buy things like $130 colostrum supplements or $10,000 plunge pools, or Casey's continuous glucose monitors. And they call this healthcare. But they don't acknowledge the billions of dollars in Medicaid cuts this administration is proposing that will target and directly harm the people who are struggling the most with their health.
This perfectly illustrates the disconnect we're facing. We have wellness influencers in positions of power who are focused on optimizing health for those who can afford expensive devices and supplements, while policies that help those most in need are being cut. Dr. Jess concludes with this powerful statement.
Real public health means ensuring that everyone has access to the basics: food, housing, healthcare, clean water, safe environments, and economic security. Right now, millions of people in this country, the ones struggling most with their health, don't have those basics. Public health, as opposed to optimizing your own personal wellness, is about policy and systems. If we confuse the two, if we let wellness entrepreneurs define the future of public health while defunding the systems that protect it, we won't get a healthier society. We'll get a more unequal one, where those with power and privilege can buy their version of health and the rest are left behind.
As a doctor, I'm all for each person making their own health decisions. It is your body and your health. But when it comes to policy and public health, we need solutions that work for everyone, not just for those who can afford them. I want to take a moment to look at what Dr. Casey herself says is important in her website newsletter. Some of her priorities include she wants to remove what she calls conflicts of interest in school lunches. She wants to investigate toxins in our food and put warning labels on processed foods. And importantly, she wants to reform vaccine injury laws and investigate what she calls cumulative effects of vaccines. The job of Surgeon General isn't about promoting personal wellness trends. The Surgeon General leads 6,000 public health service officers and is America's doctor, the voice we turn to during health crises. When COVID hit, we needed a Surgeon General who could clearly explain vaccine science. When kids were dying at the highest rates in 2021 from gun violence, we needed someone to declare it a public health emergency. Dr. Means' emphasis on investigating vaccines rather than promoting them, her focus on supplements rather than ensuring basic healthcare access, and her promotion of expensive wellness approaches. All of this suggests she is not aligned with what the job actually requires. We need a Surgeon General who understands that real public health happens through policy and systems that serve everyone, especially those facing the biggest barriers to health. Did something in this episode click for you? Share it with someone who might need these insights too. Because here's the thing. Real healthcare happens beyond clinical walls. It happens in policy meetings, community centers, and yes, even in conversations like the one we're having right now. When you understand more about your body and the systems shaping your healthcare, you become a more powerful advocate, not just for yourself, but for everyone you care about.